Varicose veins are the lumpy, squiggly, tortuous veins that we see in people's legs that sometimes they're asymptomatic, but they're nearly always quite unsightly, and on many occasions are associated with discomfort or swelling or itching. Varicose veins are not just a cosmetic problem. Unsightliness may be an important concern, but it's a progressive condition, so left untreated they tend to get bigger, more unsightly, but more crucially they can start to damage the skin. The skin can start to get quite itchy and thickened, and left untreated in many cases can cause quite bad skin damage, and the end result for some people is in later life developing a leg ulcer. And certainly the patients that we see with leg ulcers, 90% of them are due to varicose veins which hadn't been treated. So emphatically not, it isn't just a cosmetic problem. The key to treating varicose veins is to not so much to examine from the outside, but to do a detailed Doppler ultrasound scan to look at the veins inside the leg, because nearly always the lumpy faulty vein on the outside is due to a valve somewhere inside the leg that stopped working properly, and it's allowing blood to flow in the wrong direction, and the pressure blowout causes the veins on the surface. So the most important thing in varicose veins, once the clinical assessment is done, is to do a Doppler ultrasound scan to work out what the internal problem is in the leg. Once that's done, there's a multitude of different treatments now, and the selection of treatment is strongly influenced by the finding on the scan. Thread veins are or spider veins or capillary veins or telangiectasis, pretty much all the same thing, but they are purpley, reddy blotches of squiggly veins on the skin surface, which are very fine, but because there's lots of them close together, they can be quite disfiguring. They can look like a large bruise that doesn't go away. And even though they're not particularly important from a health point of view, they can be very unsightly, and people can be very self-conscious of them. Thread veins can be very effectively treated, but it's very important to make sure there's no underlying vein anomaly first. We often see patients who've gone to a great deal of time and trouble and expense trying to get rid of their thread veins, and when they're assessed more carefully it turns out there's a problem inside the leg. So the protocol normally would be to assess the limb, do a Doppler scan, make sure there's no internal problem, and all being well, proceed with either micro-injections or laser to lessen the appearance of the thread veins. And the treatments are very effective, but it can take a bit longer than sometimes we would wish. It may take more than one treatment spaced out over a period of time, but by and large in the medium to longer term the results are excellent.